Let me just pin Doc so we all can see her. Um, Wonderful. Okay, Doc. So today's topic of this masterclass is common skin concerns that women face. And just 2 days before Women's Day, we have kept this session to discuss what are the specific skin concerns that women face through, from a young age to old age, and what different reasons they could be. So, without any further ado, because we also have a hard stop, I would like to ask you, Doc, what are skin concerns that are specific to women, and are there actually skin concerns that are just for women that only we face? What is your take on this?
Well, Naba, I think for sure, I think all of us in this room can realize that there are certain concerns that pertain a lot more to women. And, maybe men have some concerns of their own, but women do have concerns. And it's all related really to who we are as women, right? It's related to our estrogen status in our body. But commonly, like even when we talk about a common condition like acne, the kind of acne a girl would get is very different from the kind of acne a man would get. There's no notion of what's called adult acne in men as much as there is in women. Like in women, we'll see women having that acne even around their periods, in their 20s and sometimes into their 30s, or get a whole burst of acne in their 40s when they've never had it their whole life. So that itself is a woman related. And something we see quite often in women is thinning of hair, especially nowadays. We've seen a lot more of this. Overall, as such, there is thinning of hair in men, but they tend to lose it in this area, which is what we call as the temporal area. But in women, we tend to lose it in the front right here, and the scalp shows. So if someone pulls their hair back, it starts showing up. So that's female pattern balding. So that's something that's very specific to women. Pigmentation. Now, men and women both get photo damage, but women tend to get melasma. Like, in fact, the statistics are that 90% of Indian women will get pigmentation at some point in their life. That's for women, right? Whereas only 10% of the men will get it because it has to do with sun damage, plus it has to do with the estrogen and progesterone status in our body. Similarly, women tend to see a little bit more of thyroid. Like thyroid tends to hypothyroidism tends to affect women a lot more than it affects men. And so we've seen that quite often where women get not just thinning of the hair, but they get acne, they get extremely dry skin, right? On their face, their chapped lips, and the body area, especially like cracked heels, elbows, etc. And that's related to thyroid. Easy to gain weight, hard to lose weight, something called insulin resistance. That's also something we see with women. So these are the common conditions that we definitely tend to associate with being women.
All right. So, Doc, it seems like a lot of this is related to our body and our hormones. How does it vary for a woman's life cycle?
A great question, Nabanita. So, like till about usually the age of menarche, as we say, or puberty, right? When girls get their periods the first time.
Hmm.
That happens typically, usually anywhere between 11 to 14 years of age. Nowadays, we're seeing a little bit more earlier at 8 and 9, sadly, but again, it has down to pollution and diet, etc. But typically, about 11 to 13 is a great age to get their periods. At that time, the hormones are changing, right? Otherwise, normally everybody has similar hormone levels, but now your estrogen is developing, the progesterone is developing, the testosterone is changing. Because of this, there's a slight imbalance. And same thing happens to the boys too. But in boys, it's more testosterone led, whereas in girls, it's more estrogen led. And this causes a change in the way our skin starts behaving. Just before that, just after that, girls will start seeing sometimes excess hair growth, right, on their upper lip or the chin area, sideburns, etc., where they start seeing excess hair growth, again related to the hormone changes. This is typically what happens during the teenage years, and by 17 to 18, when the growth phase is over, it kind of ends. But sometimes it goes on to the 20s. And that's when we call it as adult acne. Now, somebody with this, if they're getting into adult acne, again, we're looking for hormone changes. Typically, again, progesterone, estrogen, and we're also looking at DHEA, another hormone, which is called dihydroepiandrosterone, which means the precursor to testosterone. It converts to testosterone in our body. Most people don't realize this, but girls and boys both produce testosterone, except girls also produce estrogen. That's the difference from a boy. And so there's a whole balance, right? They're both at level, um, equal players, and they have like a tug of war going on as to who's more powerful. And when there are estrogenic changes in the body, sometimes the testosterone gets the upper hand. And when that happens, it represents itself in terms of acne, oiliness, excess hair on the body, less hair on the scalp, and then oiliness in the skin, which I talked about, insulin resistance, easy stretch marks. Similarly, there's another hormone called cortisol. Women tend to produce more of cortisol, which is what's called a stress hormone, than men do. So when we produce this, it causes laxity in our skin, right? So we lose the firmness in our skin, and skin loses its stretchability. So it leads to easy stretch marks. So that's another thing that we notice. And then come our 30s. Now, in our 30s, what happens by 35? There are changes with our estrogen level because now it starts reducing. It's depleting slowly till we get to menopause between 45 to 50 is the menopausal age. So 35 onwards is what we call as perimenopause. Now, from here onwards, because the estrogen becomes lesser in the body, the skin gets drier, the hair gets frizzier, it gets thinner. And so you start seeing all of these changes happening, and pigmentation starts appearing on the skin. The skin also is not able to hydrate itself like before, because even for the collagen production and hydration, estrogen is critical. And when this goes down, there's dehydration across the face, the body, including the hair. The nails also get brittle, etc. So that leads to a whole drier skin, dry environment, which makes the skin healing slower or sluggish. So if somebody gets a cut, right, it doesn't heal well. It'll leave a mark and takes a long time to heal. So people will start pigmenting. So people who got a tan and the tan would go away quickly, now we'll see that the tan takes longer to go away. And after some time, repeated tanning will lead to hyperpigmentation in the skin. So these are the few of the notices that happens in the 30s. By the time 40s come, along with this estrogenic changes, sometimes thyroid hypothyroidism occurs. When this hypothyroidism occurs, sadly, then people notice again all of this, but 3x of this plus weight gain. And so, metabolism goes for a toss. Along with that, like I said, where there's variations in the secretion. So they'll feel that their mouth gets drier, eyes get drier, you know, and even intimate areas like vaginal secretions get drier in women because they're all estrogen related. So that's all again hyaluronic acid and estrogen. So again, hyaluronic acid goes down, there's a depletion towards dehydration. Now, somebody who had very oily skin will actually have good skin in their 30s, late 30s, because the oil is drying up, so they'll go towards normal. But someone who had normal skin is going to go to the drier side. Someone who had dry is going to get even more drier. And by now, if there's dryness, there's no healing. So definitely pigmentation and all these other concerns. So therefore, hormones are important in women, regulation of the hormones. And good diet, which is like with antioxidants and healthy, the more colorful the diet, the healthier. Same way, exercise and sleep. These are the three denominators for taking care of our estrogen.
Okay. And then, Doc, what are the common skin conditions that we should be expecting, and like what are the common skin conditions that one will get for sure?
Well, 90% of women are going to get melasma. So definitely we're going to get melasma. We're also going to look at like dark circles because there's thinning of the skin around the eye. So it sinks down. It's a sunken eye and hollowing of the eyes. We'll start seeing sagging of the skin for sure. So there's a whole skin sag. Lines, wrinkles are fine, but there's a whole sag to the skin in the 40s. If you look at men in the 40s and women in 40s always look a little bit more older, sadly, majority of the women than the men do. And that really has to just do with what happens. And that's really has to do with the deficiencies that happen, which are natural and physiological, but sadly, that's what it is. But these are the common things. Then we start seeing people, getting like eczema, which they've never had, right? Like really cracked heels and then easy nail breakages, right? Split ends, frizzy hair. This is also something that happens. And something that other thing happens is like, if especially the thyroid, hypothyroidism, the lateral part, like the outer part of the eyebrow, starts thinning and falling off. The eyebrows start getting thinner as we get older. A lot of people start seeing that the eyebrows are thinner than before and they have to use eyebrow pencils, etc., and makeup. So these are the things that we do tend to see. And another peculiar pigmentation that's very common to women is pigmentation around the mouth area, especially upper lip and just down this area, right? Like just around the corners of the lip and underneath. It's called perioral hyperpigmentation. And this is something that affects women quite often. And it's actually related to our period cycle. There are days where it's absolutely invisible, and there are days where it's really strong and visible. So you see ups and downs related to our skin cycle.
All right, Doc. So now, as we were talking about the various stages of our life and the concerns that we are going to get, you did mention that there will come a time when our skin does become sensitive. So I wanted to touch upon this fact that how does the skin become sensitive and what are, the various, maybe those signs that we can see that our skin is getting sensitive.
Right. Okay, I think one of the first signs that we see when our skin is getting sensitive is when we wash our face. When we wash our face, the skin feels a little stretched or tight. And it's not a good tightness, not the tightness where you feel, oh, my skin is firm, but a tightness where it feels like someone's like really pulling it across, right? Like a rubber band snap kind of thing. And that is dehydration. So that's pretty much one of the first signs people start seeing. Post that, they start feeling that the smoothness of the skin, right? When you run your hand through, that smooth quality of the skin is slowly disappearing on them. So instead of being smooth, the skin actually starts feeling rough in texture. And then they also start seeing that there are more pores showing up on the skin, which never showed up before. So you start seeing a lot more open pores on the skin. You also start seeing it like pigment blotchiness, right? The skin evenness, the tone of the skin disappears, the healthy glow, vitality to the skin disappears. It starts looking duller. And you feel like, you washed your face, but you still feel like you don't have a glow. It's not fresh enough and stuff. When you start depending more and more heavily on makeup, these are some of the initial signs that your skin is changing. Then comes the sensitivity to touch also. Eventually, sensitive skin tends to get redder. So, you go into the sun, it gets redder. You're in a hot environment, it gets a little redder. Or, you apply a new product, suddenly products that were suiting you are not going to be suiting you anymore. You'll find that it doesn't have the same kind of efficacy that it had before. So these are the few changes you'll see when you have sensitive skin.
Wonderful. So I'm moving to the last question from my end. Before that, I would just like to tell everybody that if you have questions, you can put it there on the chat for Dr. Chytra, and we will take it up with our Q&A round. All right, moving to the question, Doc. So what is a simple skincare that you would like to suggest to everybody? And then let's go into maybe the specific skin concern.
Sure. I tell everybody this, Nabhanita, and you know it, like it's my mantra, right? Skincare is super easy. And all we need is maybe a minute or two in the day and a minute or two at night. So there's only 5 steps that you really have to keep in your mind for any kind of skincare routine. Doesn't matter if you have regular, normal skin, healthy skin, damaged skin, whatever it is, 5 steps, right? The first step is a cleanser. So always look into a cleanser. Now, when your skin is young, it's very forgiving. The Doesn't matter what you put, it forgives you. But as we get older, it's gonna get traumatized because its own barrier is broken, right? The skin barrier. So a pH balanced or a soap-free cleanser. That's all that you require, honestly. Second step comes what we call as repair or treat. Now you would use this, you'd use a serum or a cream based on what your skin condition is. So if it's dry dehydrated, you're looking at hyaluronic acid, ceramides, squalene. And if you're looking at oily or acne prone skin or open pores, you're looking at azelaic acid, retinol liposomes, salicylic acid, niacinamide. But if you're looking at pigmentation, you're looking at more like lactic malic acid, kojic acid, licorice, emlica, all of these, right? That's your step. So another serum and then sunscreen. If you're very dry skin, then you would use a moisturizer. Now, always remember your moisturizer, just using shea cocoa butter is great for the body, but not for the face. For the face, once you're over 25 years of age, you need to use ceramides to restore the skin barrier because ceramides are already there in your skin. And we're losing that. Because we're not putting enough of it, the skin's going to get drier and drier. So, ceramide based moisturizer and sunscreen, right? That's three steps, right? I mean, your cleansing is anyway, it happens with your bath and stuff. So, it's a serum, a moisturizer if required, and a sunscreen, and you're done for the day. And just choose a broad spectrum sunscreen, some water resistance. And if it has built in vitamin C, better for colored skin, which is us, right? Indian skin is skin of color because we all tan, and tan is not about looking darker, but it really is about damage that happens to our skin. Skin damage that happens over time leads to tanning. And so tanning is a sign that your skin is saying, hey, I'm hurt, stop tanning me and stuff. That's it in the morning and you're done. When you get a chance to reapply that sunscreen, as a dermatologist, I'll tell you, please reapply it in the afternoon. And you can, right? Even on top of the makeup and stuff like that, a gel prep like the SkinQ Sun Protect is great. Nighttime, what do? Cleanse and then you moisturize, right? If you have a condition for your skin, then you treat that. Like I said, you use a treatment serum and a moisturizer and you're done. That's it, right? It's really simple. But remember, the skin has a life. It has 28 days in its skin cycle. So every 28 days, we need new skin to come up. So skin needs to be stimulated or boosted, right? That's step number 5. And that happens once a week to all skin types over 25 years of age. If you're under 25, you do it once every 2 to 3 weeks. But if you're over 25, it's once a week where you apply like a AHA, BHA lotion. Like if you have oily skin, you'd use salicylic acid. If you have dry skin, pigmented skin, you'd use like glycolic acid. But right after that, you need a mask. People make this horrible mistake, Nabanita, of putting a AHA, BHA lotion or a glycolic lotion and then just leaving it. You shouldn't. When you've used that kind of an exfoliant lotion, you need to put a mask because you want that skin to get sealed. So that's why you do that as 2 steps or 1 step, but once a week is ideal where you do that and that keeps your skin boosted. That's all there is to a routine skincare.
That is really, really simple. And I think a cleanse, which is very, very simple. You just need to cleanse your face. You move into a serum, which is specific to your skin concern. And then you use a moisturizer and maybe a sunscreen in the daytime. And for once a week or twice a week, like you said, we just need to boost our skin with a mask or maybe even facials, I think, Doc, as we have at SkinQ.
Yeah, we have a facial kits, right? So people who have facials, right, like on a regular basis and stuff, it's great to have a facial. It feels nice, relaxing, and everything. But if you can have something with actives, like we call it a peel in a box concept. So if you can get it in a clinic, great. If you can do it in the comforts of your home. It's a DIY 5-step program for you, or you could even just get a facialist to come home and do it. Like sometimes some of our we have customers at SkinQ call like a therapist from Urban Clap or one of those home spas and give them the facial kit and say do this facial instead of your facial. So there are so many options out there to do that, but that's once a month, just to keep that skin healthy.
Great tip, Doc. Okay, now the last part that we have is, Doc, we want to move into gut health and diet. If there is any diet that we should be maintaining to keep a healthy skin throughout our entire life. So, Doc, we just have 4
Great
minutes
question.
and then we'll jump into the question.
Okay. All right. Well, gut health. Oh my gosh, so important, right? Like everybody always used to say, right? In India, though, we always say what you eat garbage in, garbage out. And
Mm.
that's true. Because even our skin is a reflection of what's happening on the inside. And today, like for conditions like eczema, psoriasis, rosacea, very sensitive skin, even acne to a certain degree, we talk about gut health and about the inner lining, and how if your inner lining in your gut is healthy, then this is best for you, and it takes care of your skin conditioning on a routine. And so people don't realize that. But people, when they say I have acidity, I need to take an antacid, or they say that, I have a regurgitation issue, those are the people who have problem with their gut health. So that kind of problems will actually lead to skin problems, where they get red rashes on the cheeks, and they can actually get more breakouts, but not acne, but acne like breakouts. So gut health is very critical, because it's also related to the inside environment, is a reflection to what happens physiological status. That's what we call it. Like our skin, our body has to have a pH of 7. We don't need acidity on the blood area. The blood has to be like a 7 pH, like water kind of thing, right? You don't want it to be very acidic. Whereas the gut acids are zero point 0.1, 0.5, because they have to break everything down. They're pure acids. Now, when the acidity increases, we all have good bacteria and bad bacteria. It's a balance in there. And when that happens, the good bacteria stops, because it gets annihilated by the acid. The bad bacteria thrives. When the bad bacteria thrives, it causes breakouts on the skin, not acne, but rashes and increased sensitivity. This is what we commonly see. So we always say gut health is very critical. I always tell my patients that, the more colorful the food, the better, because that's antioxidants. Because the only way to fight off free radical damage is antioxidants. If you can get it in your food, great. If you can't get it in your food, take the antioxidant supplements. That is critical to do.
All right. So, Doc, then are there any supplements that we should make a part of our diet?
Yeah. So, I think especially for women of India, it's important that we keep a check on our iron, our vitamin D, and our vitamin B complex. Uh, a lot of Indians, like 90% to 95% of Indians are deficient in vitamin D. 70% of Indians are deficient in vitamin B, and around 70 to 60 to 70% of Indians are deficient in um, iron. So it's important that you check your level and get them up. You always want to be on the higher side of normal. So if a normal for a vitamin B is like 250 and above, you don't want to be at 250. You want to be at least a 700. The reason is that you want to be 2 to 3 times the baseline of a normal, because that means even if there's a slight fluctuation, you're still above normal. You're not going into the deficient status. Same way for vitamin D. What women don't realize is vitamin D is extremely important to us. The reason for that is, for any of our hormones to get made, vitamin D is absolutely critical, because vitamin D is the substrate required to make hormones. And so, if you're deficient in vitamin D, then our hormone production goes down, which causes a disarray on the internal environment. So, vitamin D is, we have to be careful. And vitamin D is also needed for the absorption of other minerals and vitamins, including calcium. And if our body is not getting enough calcium, it will actually break our bone to put calcium into our bloodstream. So that's why women are more prone to osteoporosis. So those are critical. Iron, because of the energy, the blood, the oxygenation, etc. And also hair. Hair really requires iron. And if you're iron deficient, the first thing we'll see is you do this and bunches of hair fall. So these are the three most critical for everybody. Then comes the antioxidants. You're over 25, or if you have damaged skin, then definitely antioxidants like lycopene, which is a tomato extract, pycnogenol, pine bark extract, alpha lipoic acid, glutathione, vitamin C. These are great to have in the system. And of course, curcumin, turmeric.
Wonderful. I think those are quite an interesting list of supplements to look out for. Okay.
Hmm.
Sadly, we have our session coming to an end, and we'll begin with the questions now, Doc. First question to you, Doc, is from Twinkle. She wants to know the best home care or maybe treatment options for open pores.
Okay, once you get open pores, Twinkle, you can't close them unless you have procedures done at the clinic. The procedure would be like a fractional laser combined with like a growth factor infusion into that area. Around 6 sessions, it'll give you maybe 20-25% improvement in your open pores. But at home, you should look at using retinol-based products. So just a bakuchiol is not enough. You'll need a retinol complex, or in the doctor's office, will give you Tretinoin, which is a prescription version. So this is what you'll have to apply to prevent those pores from getting larger. But once you have the pores, you can't shrink them back, right? Maybe 5 to 10%, not beyond that, with creams and lotions. That too only if you're using prescription strength Tretinoin. But you can maintain your skin so that it doesn't get worse.
Next question, Doc, for you is, does a cleanser need ingredients like 3 essential ceramides or salicylic?
Well, see, the thing is, how long do we have cleanser on our face? Think about it. You wash your face, take 2-3 pumps of cleanser, rub, maximum 30 seconds, 40 seconds. What you need are barrier repairs or non-sensitizing products. Otherwise, it's not going to be efficacious. If you have extremely oily skin, very oily skin, you can use salicylic acid, because that salicylic acid, even for 10-15 seconds on the face, can help just remove the surface oil. It's not going to reduce your oil or anything, but it will help remove surface oil or grease. But if you have sensitive skin for women, what's good is to have like a niacinamide in the cleanser, because niacinamide is a barrier function product. It's already there in our skin. It forms like it helps make ceramide. So it doesn't strip the skin of its oil, natural oils, only excessive oils. So a niacinamide would be great to have in your cleanser. But otherwise, vitamin C, vitamin E, brightening agents has no effect, zero. So just a pH balance cleanser is enough.
The next question, Doc, we have is from Arpana. Arpana wants to know about a good hair oil and how should we care for long hair?
Okay. Good hair oil is what suits your scalp, honestly. Pretty much oils are oils and stuff, and they use the oil molecules to give nourishment to the root of the hair. So you have to apply hair oil into your scalp, not onto the hair. That's not no use. So split your hair into sections of 1.5-2 inches. Put the oil on and gently massage. Put oil, massage, and keep the oil warm, because when you put a warm oil, it increases the blood circulation. So the absorption of oil itself increases into your scalp. And oil is just nourishment, right? Like vitamin E and fatty lipids and stuff. So that's why it's nourishing to your scalp and not to your hair per se. And in terms of long hair, when you shampoo only your scalp, and towards the end of the shampoo, just run it through your hair. Don't try and shampoo the entire hair. You'll frizz it out. Put a conditioner. You can put a conditioner onto the entire hair, but leave about 1.5-2 inches from the scalp and then condition it. Otherwise, the hair gets limp. And trim it every 8 to 12 weeks. If you see split ends, get rid of them immediately. And make sure that you have enough oral supplementation. If you're taking biotin, throw it down your dustbin, because biotin on its own is useless. What you need is iron or ferrous salt, really not even ferric, but ferrous form of iron. You need minerals, microvitamins, and antioxidants, and lots of amino acids and protein for your hair. So this is what's critical.
Next question is, Doc, there are small bumps, maybe bumps on my face, not smooth toned. What is the treatment for this?
Oh gosh, it could be so many things. It could just be comedonal type of acne. It could be papules. It could be a rosacea. So many options for this. You know, SkinQ has this free consultation with dermatologists. So why don't you sign up for that from the website at skinq.com, and you can meet one of our dermatology panels to get an assessment.
Wonderful. So we'll take one last question from the audience. Okay. Kanika here wants to know, is it possible to treat textured skin as I am over 40?
Of course it is, Kanika. 40 is like the new 20s, honestly. And there's so much technology out there to get your texture of your skin going great. You know, skin texture, it's about smoothness, it's about, you know, hydration, and radiance at the end of the day. So definitely it can be treated. You being 40 has no bearing on it, except that we'll probably put you on like a Hydra pill supplement to hydrate you from the inside, because it really, a lot of times it's related to dehydration and collagen depletion. Taking collagen will not help, but protein diets, etc., will help. But we can talk about it, and you can get a consult with us.
Wonderful. I've posted the link there for our SkinQ doctor consultation on the chat. I think, Doc, we have time to take just one last question. Okay.
Yeah, you have 3 minutes left.
Definitely. So I'm just going to take this one question which says, any home treatments for face melasma?
No, there isn't. Sorry, love. There isn't, because you have a condition, and skin is the largest organ in our body. It is an organ, a living organ. So any condition on it is a disease to us. Melasma is one of the largest pigmentation disorders. If you have melasma, use the vitamin C glow serum from SkinQ, follow it up with the sun protect gel, which also has built-in vitamin C and is clinically proven to reduce pigmentation in 14 days, and stop tanning. Second, third, at night, use the D10 or the brightening serum, which increases your brightness by 35% and reduces pigmentation by 15% in just 4 weeks, and follow with the moisture balm. This is your regimen. And also a glow bright mask 2 times a week, 15 minutes, and it'll reduce your melasma and get you looking much better within 3 months. Always remember, melasma means at least 3 months of treatment. And then you can always come to the clinics for procedures.
Great then. I think this was a very, very informative session, Doc. Thank you so much for taking some time out on a Monday evening and doing this for all the women here who wanted to get some, some session with you. And you have answered so many great questions. And I'm pretty sure that all of us would have had these questions sometime or the other, in our lives. Thank you so much, Doc, for taking your time out. I hope.
Thank you. Bye.
Thank
you all. Bye-bye. Bye.
All right. Thank you, everybody, for joining the session. Just to let you all know that you all will have free products delivered to you at your addresses. So we just want you all to fill up this form so that we can capture your phone number and your address, and you will get a free SkinQ product delivered to your house. Can we have the form put in here, please? Dipali, are you there?
Okay. Yeah, I'm just a
all
second.
Right, great. So while Dipali is putting the form out, I would just like to repeat one last time that, guys, we had this social media contest running. So I hope you all had, the best session and got the chance to ask questions to Dr. Chytra. And if you didn't, you can definitely go to SkinQ website and opt for our free consultation with our team of dermats in association with Cosmo Derma. So it's a 15-minute consultation, which is completely free. You can have your time with an expert, skin expert, and get your questions answered. Definitely go up to skinq.com and check out the Dermat Consult. Okay. Can we have the form there? Yeah. So the Dipali has put the form there in the chat. Please do fill it out and you will have your products delivered at your home. Thank you, everybody. Have a great evening.